Thanks, eukaryote. Today I will talk about colon cancer and its screening. Colon cancer develops in the colon and the rectum, located at the end of the digestive tract. Begins as a non-cancerous polyps, which are flat lesions that grow on linings of the colon. This is the fourth most commonly diagnosed cancer and the fourth leading cause of cancer deaths in both men and women in the United States. Men have slightly high incidence of colon cancer than female, and the black population has high incidence than white, American Indian, Asia Pacific, and Hispanic. This is a slide I want you to pay attention to. Starting from age 50, the rate of incidence has risen significantly. This is the reason why American Cancer Society recommends to start colon cancer screening at age 50. Because of increased colon cancer screening, the annual rate of colon cancer has decreased steadily. Compared to the prostate cancer and female breast cancer, 5-year survival rate for colon cancer is much lower. Prostate cancer at 97% at 5-year survival rate, breast at 89%. However, colon cancer is only at 63%. What's the reason? We do not diagnose the colon cancer early enough. We check a prostate, we check a mammogram, but we always forget to check colon cancer. Colon cancer is curable if we find and diagnose them early enough. 5-year survival rate is not the difference between man and a woman. And the younger age has slightly better survival rate comparing to people who is older than 65. However, the most important fact impact the 5-year survival rate is staging at the time of diagnosis. If diagnosed at early stage, survival rate is more than 90%. However, at a later stage, when you have metastatic disease, the 5-year survival rate is only 11%. The key point of improving survival is early diagnosis, and this can be achieved by colon cancer screening. The risks associated with colon cancer can be modified or cannot be modified. Age is a non-modified risk. Incidence and death rate increase with age. 90% of new cases and 93% of deaths occurred in people 50 and older. Gender is a non-modified risk. Men has slightly high incidence and mortality rate than female, and colorectal cancer rates are higher in black men and women, and lowest in Asia and Pacific Island men and women. Family history also plays an important role, which is a non-modified risk. People who has first-degree relatives, such as parent, sibling, offspring, who has a colorectal cancer, will have 2 to 3 times the risk of developing the colon cancer. And the relative was diagnosed at a younger age even has a higher risk. If there are more than one affected relative, the risk of the colon cancer increases 3 to 6 times that are of general population. Family history of adenomas, and statistics showed having a family history of colorectal cancer is associated with better disease survival. Maybe this is due to increased awareness and earlier screening and detection. Heredity such as Lynch syndrome and familial adenomatosis, polyposis also are non-modified risks. 4% of colon cancer are related to the Lynch syndrome. Familial adenomatosis, polyposis are genetic factor. It is characterized by the development of hundreds to thousands of colorectal polyps in the affected individuals, with a lifetime risk of colorectal cancer approaching 100% by age 40. The management is take out the entire colon. The last non-modified risk is personal medical history. Person who has a history of colorectal cancer has a high risk of recurrent and second colorectal cancer, which required routine colon screening, colonoscopy. History of adenomatosis polyps, especially larger polyps and multiple polyps, has higher risk of the colon cancer. Chronic inflammatory bowel disease such as ulcerative colitis and Crohn's disease. Person who has diabetes. What are the modifiable risks that could lower the colon cancer? One is to engage regular physical activities, 25% lower risk, and maintain a healthy body weight. Ideal body mass index is 19 to 24. Overweight, obese will increase the risks of colorectal cancer, which is independent of physical activities, especially abdominal obesity. Eating a healthy, well-balanced diet, and limit alcohol consumption and quit smoking. 2 to 3 alcohol drinks a day will have 23% higher risk of colorectal cancer. What can we do? What can we eat to lower the risk? Intake of dietary fiber, cereal fiber, and whole grains is associated with a reduced risk of colorectal cancer. 10 grams of dietary fiber consumption will bring 10% reduction in colorectal cancer. Moderate amount of fruit and vegetable intake is slightly protective against colon cancer. It is recommended to have 3 portions of fruit and 7 portions vegetable. 1 portion is 1 handful amount. High consumption of total dairy products such as milk decrease the risk of developing colorectal cancer. However, high consumption of red and processed meat increase the risk of both colon and rectal cancer. Medications such as aspirin and other NSAIDs reduce the risk of colorectal cancer, but has increased the risk of GI bleeding. So if you are going to take aspirin and NSAIDs daily, please check with your primary care physician first. High level of vitamin D is associated with slightly lower risk of developing colorectal cancer. 70% of population in the United States has certain degrees of vitamin D deficiency, so it is beneficial to have daily vitamin D supplements. 800 international units is good amount. Dietary folate intake decreased colorectal cancer risk. What are the signs and symptoms of colorectal cancer? Most people presented with anemia, which results in weakness and excessive fatigue. Rectal bleeding, dark or black stool, change of bowel habits and stool consistency, constipation alternating with diarrhea, change in the shape of the stool, decrease the caliber of the stool, cramp or abdominal comfort in the abdomen, urge to have a bowel movement when the bowel is empty, and unintentional weight loss. So early detection and prevention is the key, which will lead to a higher survival rate. The purpose of colon cancer screening is to have better outcome, to have higher survival rate. This is by prevent colorectal cancer to happen and also detect the colon cancer at an early stage to ensure people get timely treatment. Statistics showed nationwide, 67% people get up-to-date colon cancer screening, 7% of population had a colonoscopy but not up-to-date, and 25% never had a colon cancer screening. In Texas, only 60% of Texans had some type of colon cancer screening. So we are behind. How does screening work? So colon cancer begins as a non-cancerous polyps, which is asymptomatic. So colonoscopy could detect the precancerous polyps in the colon and the rectum and remove those polyps before they turn into a cancer. Screening is to prevent the cancer from occurring and also detect the colon cancer at an early stage when they are curable. So recommend to start colon cancer screening at age 50 or earlier, or earlier for high-risk individuals, for people who has Lynch syndrome, family history, and adenomatosis, polyposis. The screening methods are the following. Colonoscopy is the gold standard, starting at age 50 for both men and women. The other tests are annual fecal occult blood test to check hidden blood in the stool, need to be collect stool sample for 3 days. Cologuard, DNA stool test, which need to be done every 3 years. CT colonograph, use X-ray to view images of colon every 5 years. And a flexible sigmoidoscope, view lower third of the colon every 5 years. 37% of the colon cancer occurs in the cecum, ascending colon, transverse colon, which cannot be reached by sigmoidoscope. So flexible sigmoidoscope will miss this 1/3 of the colon cancer. What is a colonoscopy? Colonoscopy is a procedure that the doctor look into the colon. A scope will insert through the anal, through the colon, and the doctor could examine the entire colon. They may take a small amount of tissue and remove the polyps. They can also control and prevent the bleeding or stretch a narrow area. Again, screening colonoscopy start at age 50 for both men and women. What do we do to prepare for colonoscopy? First, you need to tell a doctor if you have diabetes, if you are on blood thinner. 5 days before the procedure, you need to stop taking blood thinner medications such as Plavix, Coumadin, aspirin, Motrin, vitamin E, ginkgo. You need to stop taking iron and iron-containing vitamins, no nuts or seeds. Discontinue fiber supplements such as Metamucil, band fiber. You will need these items for your colonoscopy. Proper solutions such as Golightly, Newlightly, according to your physician's preference. 6 tablets or Dulcolax laxative. And a clear liquid. If you have constipation, you will take milk of magnesium 2 days before your procedure. What can we eat to prepare for the colonoscopy? It's all clear liquid diet that you can see through, such as water, tea, coffee. You cannot put cream or sugar in your coffee. And sports drinks, lemon flavored drink mix, fruit juice without the pulp, jello, soup, bouillon, and you cannot eat or drink anything that is red color, purple color, or blue color. And remember again, you cannot eat anything with seeds 5 days before. On the day before your procedure, you need to take your usual prescribed medication. If you have diabetes, you should take your diabetes medication at half the usual dose and monitor your blood sugar at your usual time. You begin a clear liquid breakfast and remain on this clear liquid diet all day. At noontime, take 2 Dulcolax tablets with a glass of clear liquid. 4 o'clock, take 2 more Dulcolax with a glass of clear liquid. At 4:30, you need to start to drink the first 2 liters of bowel prep solutions. Try to drink 8 ounces every 10 to 20 minutes and refrigerate the remaining 2 liters. Feeling of bloating and abnormal fullness and nausea are common because of the large volume of the fluid ingested. These feelings are temporary and should subside shortly after the bowel movement starts. If you have discomfort with gas, you can take Gas X and Simethicone, which are over-the-counter medication. You need to stay close to a toilet. If frequent stool irritates your anal area, you need to clean your anal area and rinse with water. You may use medicated pads such as Tux and petroleum jellies. You do not drive a car, operate a machine, or go to work until the day after your colonoscopy. On the day of your procedure, you please take your heart medication, your blood pressure medication early in the morning with small amounts of the water, and do not take a diabetic medication on the day of your procedure. Insulins may take half of the usual dose. Please check your primary care physician for the dosage. In the morning, 4 hours before your check-in, take 2 Dulcolax tablets and also drink the remaining 2 liters of prep solution. After that, you cannot eat or drink any liquid. you need to bring an adult to take you home. If colon cancer was diagnosed, you need to see a colorectal surgeon, medical oncologist, and also radiation oncology if you have rectal cancer or anal cancer. Emergency procedure will be performed in case of obstruction and rupture. Otherwise, you will have initial staging workup, including CT chest, abdomen, and pelvis, and a possible MRI of the abdomen if you have abnormal CT scan. Colorectal cancer treatment depends on the size, location, and how far the cancer has spread, which include surgery, chemotherapy, and the radiation. In summary, survival depends on staging at the time of the diagnosis. Prevention and early detection is most valuable, which will lead to high survival rate. Start screening colonoscopy at age 50. Colon cancer screening equal to high survival rate. So let's do it. Thank you.